So now let's talk about glaucoma. What is glaucoma? How is it dangerous for our vision and eyesight? How it can be found out? How it can be managed? So try to simplify it as much as possible. Glaucoma is the damage to the optic nerve and retinal cells of the eye, mostly called as nerve fiber cells, which process and take the vision to the brain where we can see. Now, how does this optic nerve damage occur, and the nerve fibers of the retina, how are they damaged in glaucoma, is a question which has only been partially answered till date. What is known is that the pressure inside the eyes, which is known as the intraocular pressure, has a certain range in most of the individuals. If the pressure becomes more, then chances of glaucoma increase. So it is presumed that to some extent the higher pressure inside the eye can cause or significantly contribute to the damage of the retina and the optic nerve of the eyes, causing defects in vision and glaucoma. So, high intraocular pressure is a very big risk factor for glaucoma. As a corollary, there are some patients where the intraocular pressure is in the normal range, but still these persons have glaucoma. That is known as normal tension glaucoma, and lots of presumptions and research is going on why this happens. So one of the risk factors we have already discussed, and that is a high intraocular pressure. The other major risk factor is genetics. It is a familial disease. If people in your family are suffering from glaucoma, it is very important that you keep yourselves checked up regularly, especially after the age of 40 years. If your parents or siblings have glaucoma, this becomes very important, that because your risk increases much more. So glaucoma is a genetic disease. Now the most common type of glaucoma, which is known as the open-angle glaucoma, usually occurs after the age of 40 years or so. Usually does not occur in a younger age group. So very important that once you grow older, after the age of 40, once you start getting glasses for your near vision, it is all the more important that you keep yourself getting checked up for glaucoma also. When you go to an eye doctor, he will check up your eyes, he or she will check up your eyes, gender neutral we have to be, and if they find anything suspicious, they will investigate you for glaucoma. One of the tests is to screen for the intraocular pressure. So blind screening of intraocular pressure does not have that much importance unless and until the eyes are also checked up, because high intraocular pressure can give us a suspicion, but we have to check up the eyes, we have to see the retina, we have to see the optic nerve, and then if we are suspicious, then we get to do certain special tests known as the visual field analysis, which shows whether there are any defects in your visual field, and also a comparatively recent test which shows us whether the optic nerve has been physically damaged or the retinal nerve fiber layers are physically damaged. It shows us the damage in a physical term. So more of an anatomical test, but it's also important. This test is known as OCT. So all these things help the doctor. The diagnosis becomes clinical as well as investigational, but the clinical diagnosis is very, very important. Now supposedly, let's say that somebody has been diagnosed with glaucoma. So this is not the end game. This is not the infinity war. There are very, 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 very good medicines available to control glaucoma. So do not think that if you are diagnosed with glaucoma, or previously in colloquial language we call it in Hindi kala motia, that it spells the end for your vision. It does not. You can live a healthy life with good vision if you do a few things. Firstly, the doctor prescribes you certain medicines to control glaucoma, and you have to put those medicines as the doctor prescribes. So many times I tell my patients, if you want to forget taking a meal, that's okay, but if you forget putting your medicines, that is not okay. So there are many medicines available which control the glaucoma by controlling the intraocular pressure beautifully. And it has been seen that once we control the intraocular pressure, we can stop or at least reduce, slow down tremendously the progression of the damage to the optic nerve and its elements due to high pressure. So keep the doctor in sight, put your medicines. If he calls you for follow-up after 1 month or 2 months or whatever, please do not miss that follow-up. If he tells you about investigation after 6 months or 3 months or 1 year, please get them done, because vision is very important, sight is very important. We cannot play around with these things, and the best part is that we can keep the vision okay, we can keep the sights okay for many, many, many years, and research is continuing, and new and better drugs are in the offing. The treatment is not the same as it was 10 or 15 years ago, and it will not remain the same after 10 years. So if we preserve the eyesight for long enough, we are definitely going to have even better treatments. Today we have drops available, we have laser available, we have surgery available, and the take-home message should be that you can live a good life with glaucoma. For many, many years, glaucoma can be controlled, and if you are careful, slightly, and sensitive that you have to keep your vision okay and put your drops and are compliant and keep the doctor in sight, you will always have good vision. That is my promise to you.